Okay, so let's take a look at another topic of pediatrics, that is celiac disease. So, how will a child with celiac disease present to us? He will present with the symptoms of malabsorption, that is diarrhea after weaning, weight loss, edema, steatorrhea, mild abdominal distension, and oral ulcerations. So, the diarrhea will be after weaning, in contrast to diarrhea before weaning in lactose intolerance patients. So, in this case, the diarrhea will start after weaning, and the child will present with weight loss, edema, steatorrhea, mild abdominal distension, and oral ulcerations. In addition to that, he will also present with iron or folate deficiency anemia, pubertal delay or short stature, dermatitis herpetiformis, osteoporosis, and tetany due to vitamin D deficiency that is associated with other nutrient deficiencies in case of celiac disease, because it is a malabsorptive disorder. Now, how will you investigate a child with celiac disease? Number one, the gold standard investigation is the duodenojejunal biopsy, and you have to take at least more than 4 biopsies from second part of duodenum and one from the duodenal bulb. And this biopsy specimen will show subtotal villus atrophy, that is blunting of villi and intraepithelial lymphocytes. So this test is the gold standard for celiac disease, that is duodenojejunal biopsy. Secondly, you can also do serology for certain antibodies. These antibodies include IgA anti-transglutaminase antibody, which is also called as anti-tissue transglutaminase antibody, which is the best test to perform for celiac disease after biopsy. In addition to that, you can also do IgA anti-endomysial antibody, IgA anti-gliadin antibody, and IgG anti-gliadin antibody. So these are the antibodies that you can test for celiac disease. Third is the HLA tissue typing. Number 4 is the CBC. Now CBC will show microcytic anemia in case of iron deficiency and macrocytic anemia in case of folate deficiency. So iron and folate deficiencies are also associated with celiac disease due to it being a malabsorptive disorder. Biochemical tests which we can run include calcium, magnesium level which will be reduced, total protein level which will be reduced, and albumin and vitamin D level again which will be reduced. And bone density will be tested in case of osteoporosis. It will show osteoporosis or a reduced bone density. So how will you treat a case of celiac disease? First of all, the most important thing here is the dietary therapy, which will include a lifelong gluten-free diet. This means that you have to avoid wheat, oats, and barley. Now, what are the products which you can give to the patient? You can give rice, meat, dairy products, vegetables, and fruits. These are safe. And avoid alcohol as well, because it also causes malabsorption. And as we all know that celiac disease is also associated with dermatitis herpetiformis, so you will give dapsone for that. And supplementation of various vitamins and minerals will need to be done to compensate for the malabsorption, and it will include different vitamins and minerals, especially the fat soluble vitamins. And folate should also be given in women of childbearing age. And in addition to that, pneumococcal vaccine should be given once in 5 years because of splenic atrophy. So yes, celiac disease is associated with splenic atrophy, so the patients of celiac disease should also receive pneumococcal vaccine once every 5 years. And if the disease is not controlled on the above therapy, then the patient might also be required corticosteroids with or without immunosuppressive therapy like methotrexate, azathioprine, leflunomide, etc. So these were the important management steps, and the differential diagnosis of celiac disease includes Crohn's disease, tropical sprue, Whipple's disease, and giardiasis. So let's revise it once. We were talking about celiac disease, which is a malabsorptive disorder. It is actually an autoimmune reaction to the gluten component of diet, especially in wheat, and it has to be investigated via duodenojejunal biopsy, antibodies, HLA typing, CBC, biochemical test, and bone density. And the treatment options include gluten-free diet, and dapsone for dermatitis, supplementation of vitamins and minerals, pneumococcal vaccine, and corticosteroids with or without immunosuppressive therapy in case of resistant cases in which the gluten-free diet avoidance is not helping. So these were some of the important points regarding celiac disease. I hope it was helpful for you guys. Thank you so much for watching.